How do other drugs affect my treatment?
There are a number of particular interactions that can be of concern. We know that methadone can interact with a number of anti-epileptic drugs and a number of antibiotics. We know that both methadone and buprenorphine can also interact with any medication, whether prescribed or not prescribed, that makes you sleepy. So it can make you additionally sleepy and can be a risk to your health. It's really important as a general rule that you tell any healthcare practitioner that you come into contact with all the medications that you're on. You should not have any embarrassment about talking about being on a methadone program or taking methadone or buprenorphine.
Other drugs can affect methadone and buprenorphine in two main ways. One is that they can increase the sedating or intoxicating effects of methadone or buprenorphine. So methadone and buprenorphine are downers, they're depressants, they slow your brain down, they slow your breathing down. If you take other drugs that are also downers, alcohol, benzodiazepines, heroin, you get a combined effect, which means that you're more likely to overdose. The other way that medications can affect methadone and buprenorphine is by altering the way those medications are broken down, particularly by the liver. And there are some medications that speed up the metabolism of methadone. And so that means that someone who's been happily stable on 80 milligrams of methadone starts on one of these medications and all of a sudden they find out they're in withdrawal. And so what doctors will do, because they are aware of this interaction, is they'll increase your methadone dose. Doctors never want patients to be anything else other than comfortable on their dose. What doctors worry about is that patients may suddenly stop taking those medications, and then that very big methadone dose is actually now much too much for that person's tolerance, and they overdose, and bad things can happen.
It's really important that people have the right information about your health and your healthcare needs so that we can make the right decisions with you for your health.